I'm a physician who practices primary care medicine at Maine Medical Center in Portland. I'm also a priest in the Episcopal Church and a member of the Episcopal Diocese of Maine. I very rarely, as a matter of fact, almost never wear my white collar and my white coat at the same time. But single-payer health care is one of those issues which causes both of my careers to intersect in a very powerful way. I'll tell you about some of my patients. A working mother with no health insurance and no way to pay for treatment of her diabetes who shows up in my office with an infection in her foot, which left untreated could lead to an amputation. Or a self-employed contractor with no insurance and a 30-year history of a precancerous condition of the colon who cannot afford to pay for a colonoscopy, which might literally save his life. Or a 22-year-old woman struggling with depression who lost her insurance 6 months ago and who's now suicidal because she can no longer get access to her health care providers, a woman that I have to send to the emergency room for treatment. These are the patients that I see every day in our clinic. These are proud, hard-working people with chronic illnesses who want to continue to work. But because they're uninsured, they are just one medical crisis away from disability or bankruptcy or both. Health insurance should not be a privilege granted only to those fortunate or healthy enough to find full-time employment. Basic, portable health insurance, which is not tied to your employment status, would enable more of our neighbors to stay healthy, to stay in the workforce, and to provide for themselves and their families. The Episcopal Church has long recognized that our current system of health care delivery in the United States is inequitable and unjust. And since 1991, we have called for a single-payer universal health care system in the United States. We believe that health care is a human right, and that lack of adequate health insurance is one of the most pressing social justice issues today in the United States. We support LD 1345 because it would bring the state of Maine closer to our goal of adequate health care for all in the United States. Thank you very much.